friends, welcome again to my channel where we discuss the science behind this world of medicine. So today we are going to discuss about an important condition which is the enlarged prostate gland or BPH or benign prostatic hyperplasia. It is important to understand that this disease is exclusively found in elderly men. The reason is that prostate gland is a part of human biology which is found in males only. So this gland helps in production of semen and hence it is found only in men, and enlarged prostate causes problem only in men. Now, to understand how an enlarged prostate causes a problem, we need to understand where exactly is this prostate gland situated. The prostate gland is situated near the exit of the bladder, which is the first part of the urethra. So you can see in this picture that the prostate gland is situated around the urethra, which is the first part after the bladder. So you can easily imagine if this prostate gland enlarges, becomes bigger in size, it may compress this opening of the bladder and there will be problems in urination. Hence, enlarged prostate is one of the most common reasons for problem in urination in elderly men. Now we need to understand that enlarged prostate means that the size of the prostate gland increases. This size of the prostate gland increases due to a hormone called as testosterone. Now there is a difference between a swollen gland and an enlarged gland. Swelling is when there is fluid filled inside something, when there is watery accumulation or something increases in size suddenly due to collection of fluid. That is when we medically call it as swollen. But when we say enlarged prostate, we don't mean it is a swelling or it is a swollen gland. We say that enlarged prostate is due to increase in the size of the gland due to increase in the number of cells inside that gland. So hence what happens is the actual size, biological size of this gland increases, which compresses the urethra or the first part of urethra, the first exit point of the bladder. Now it is important to note that enlarged prostate is not a bad thing, is something that is manageable, and you need not worry much about an enlarged prostate, and there is hardly anything that you can do to prevent an enlarged prostate gland. So hence need not worry, it is not bad and there is hardly anything you can do about it. It's your hormonal body fluctuations and your hormonal changes in the body over which you may not have much control. Now, when you have an enlarged prostate gland, what exactly are the symptoms? So you can easily correlate that the symptoms may be related to problem in urination, which is there may be stress during urination. The urine may come out very slowly. There may be accumulation of feeling of urine still remaining in the bladder. There may be frequent urination or need to go for urination again and again because your bladder is not getting empty in every cycle of urination. Then there are chances, because urine is retained for a longer period of time, so there are chances of infection in the urine. Then there are chances of bleeding of the prostate gland due to very big size. There are also chances of having stones because urine is collecting for a longer period of time. And eventually, if the prostate gland increases to that bigger size that it completely blocks the urethra, then there will be inability to urinate. So these are the symptoms of enlarged prostate gland leading to problems in urination. Now, medical practice has an international prostatic symptom score according to which doctors actually categorize the need for treatment for a prostate gland. But on a broader scale, when you present to a medical practicing doctor with the symptoms like these, or if you have enlarged prostate, how a doctor would arrive at a diagnosis is through these 4-5 things. the first thing the doctor would see is the symptoms, which I just described to you. Then the doctor may prefer to do a urine analysis, urine routine microscopy. They may also prefer to do a urine flow cytometry, wherein they look at the urine flow rate. They may even look at the volume of urine left over after each urination. And effectively, eventually, they may do two more tests, which are digital rectal examination, wherein they feel the prostate gland through a finger inserted through the rectum. And second, they may conduct a prostate specific antigen test, PSA test. DRE and PSA test are helpful in differentiating or concluding that this is not a case of prostatic carcinoma or prostatic cancer. Because if this is prostatic cancer, DRE or digital rectal examination would help the doctor establish that through the texture of the gland. And if the PSA is highly elevated, it may be a signal. It is not confirmatory, but it may be a signal that this may be due to prostatic carcinoma or cancer, which may need a different approach altogether. So hence, a doctor would establish, yes, this is BPH, benign prostatic hyperplasia, or enlarged prostate, which is harmless. And based on the symptoms of the patient, the treatment is initiated. The treatment has two parts, the medical treatment and the surgical treatment. The medical treatment is revolving around two concepts. The first concept is relaxation of the muscles of the bladder and the prostatic gland and the smooth muscles around the urethra. So relaxation of muscles, what would that do is loosen out the constriction on the urethra by the prostate gland tissue and the urethra itself. So it will increase the size of the urethra and hence it will help in easy urination. The second concept of medical treatment is to provide medicines or drugs or medical treatment which reduces the size of the prostate gland. It is important to note that when the prostate gland is enlarged, the doctors by this medicine cannot reduce the size of the prostate gland to 100% normal. But yes, they can help in reducing about 25% of the size, which is decent enough to allow for a urination which is without any problem. Now, in severe cases, when the patient is having severe discomfort or infection or stones or inability to urinate because of the enlarged prostate, doctors may go ahead with a surgical treatment. The surgical treatment are varied, like TURP and all. They are very complicated procedures, but yes, in medical practice, surgical practice, they have become very easy for the patient. They have become like a single day visit, wherein through the urethra only the treatment can be done easily without a major surgical operation. So hence, this is the surgical option for treatment of prostate, wherein the prostate gland may be removed. So friends, I hope this information was useful for you, because enlarged prostate is a common problem of urination in the elderly men and reported to clinic very frequently, and people associate this with a stigma or a very big problem. But you need to understand, be patient, that there is nothing wrong with your body. It's just a simple physiological process in your body which is causing the problem and is easily manageable through medical and surgical options available with the medical science. So I would highly recommend you to visit your clinician, take a proper advice if you are having any of these symptoms, because now you understand the science behind this enlarged prostate and why it is causing these symptoms. So friends, if this video was useful, please like, share and subscribe, and don't forget to watch my next video. Thank you.